Hello, I'm Dr. Brian Hulsey of Foundations Chiropractic. I want to continue our series. This would be part 3 of thyroid hormone metabolism. The first one we talked about thyroid tests, what needs to be run just to adequately assess the thyroid. That is just thyroid hormone itself, not necessarily blood sugar or cortisol or some of those other things that may impact thyroid hormone. But in section 2, we talked about brain to thyroid gland. So the brain to thyroid gland, we're looking at the hypothalamus releasing TRH, acting on the pituitary gland to release TSH, which then acts on thyroid peroxidase enzyme, which is in the thyroid gland. So today we're going to pick up at the thyroid gland again. The thyroid peroxidase enzyme, it puts together iodine and tyrosine to make total T4 and total T3. So most of what comes out of the thyroid gland is total T4, about 93%. And total T3 is about 7%. So with that, some of the things that we're checking on our labs, we need to check to see if we're going after the enzyme that makes thyroid hormone. That is called a thyroid peroxidase, and antibodies means that our body is producing the proteins that bind to different things. So this could be a reason of concern because of autoimmune disease, and this is the most common autoimmune condition, or a low-functioning thyroid. So with the thyroid peroxidase antibodies, if those are positive, the body's attacking the thyroid peroxidase enzyme, so we're not able to produce as much thyroid hormone. As well as we could have thyroglobulin antibodies. This is a little protein that takes that binds to thyroid within the thyroid gland and scoots it around the thyroid gland itself. So if we're destroying the protein, then we have nothing to bind the thyroid hormone to within the thyroid gland. Now the last one, this would be more of a condition with Graves' disease or high functioning thyroid. We actually get antibodies that start attacking the TSH, thyroid stimulating hormone receptors, in the thyroid gland. So it starts amping up it starts replicating or duplicating what TSH is doing in the body. So in this case, TSH will be very, very low, and our thyroid hormone is going to be cranked out at a huge amount. So what we may see on labs is a very low TSH, but high thyroid hormones there. So all these antibodies should be checked, especially if we're concerned about Graves'. Most of the time, we're going to see that low-functioning thyroid 80 to 90% of the time, but this is going to be an autoimmune condition known as Hashimoto's thyroiditis. So where do we go from the thyroid gland? We produce total T4 and total T3. This goes on a taxicab called thyroid binding globulin, not to be confused with thyroglobulin. So it goes on this taxicab to carry it through the body, where this thyroid binding globulin can be cleaved away, giving us free fraction hormone. So the free fraction is what acts at the cell level, actually acts on the nucleus of the cell or the DNA to tell that cell to do its job or to increase the cell's job. So what happens in the liver, this can happen in other parts throughout the body, but most of it happens in the liver up to 80% of the time, is that T4 is converted to T3. Now remember back, T3, especially free T3, is our most active thyroid hormone. So we need to have good liver function here. This will show up on a comprehensive metabolic profile with our liver enzymes, as well as some other things like homocysteine levels, potentially estrogens, so there's many different ways that we can assess liver function. But bear in mind that most of this process, this 5' or conversion of T4 to T3, occurs in the liver. So this is where we get 60% of our T3. When we have issues with the liver, we're going to have decreased conversion of T4 to T3. So we need to look at liver function. And some of our T4 will go to producing reverse T3. This acts as a check and balance mechanism or a stop signal on cellular metabolism, whereas T3 is a green light. our go signal on cellular metabolism. Now, 20% of the time we produce T3 sulfate and T3 acetate. Now, so if we just stop there, isn't 60% of T3 good? Well, I'm worried about the other 40%. Yes, 20% is being made as the stop signal, and some things can increase that. We're going to talk about that in just a little bit. But the T3 sulfate and the T3 acetate, this actually travels to the small intestine and the gut mucosa. So we need to look at, to recover that 20% of T3 sulfate and T3 acetate and convert it to T3, we need to make sure that the gut mucosa is working right. So this could entail leaky gut or gut bugs or possibly food sensitivities that is causing inflammation to the gut mucosa. So I wanted to optimize as much T3 as we can because that, again, is the most active thyroid hormone. So we talked about coming down from the thyroid gland, being most of our conversion of T4 to T3 occurs in the liver. It can occur in other places in the body, other tissues such as kidney. It can even occur in the skin. But if we don't have all of our cofactors there, such as selenium, this can affect T4 to T3 conversion. If we have altered liver function, if it's not working as well as it should, that's going to affect thyroid hormone metabolism, as well as what can happen is if we have stress or cortisol and insulin surges, this could be a stressor on the body. So a stress can be defined as any change from normal function or normal physiology. This could be emotional stress, physical stress, but in this sense we're talking about chemical stress. So if we have cortisol and insulin surges, what that could do is going to shut down that guy, as well as it's going to amp up this guy. So we can see an increase of reverse T3 there. So that, again, that reverse T3 is a stop signal or a check and balance or a fail-safe on the body. What else are we going to see? We're going to see cortisol and insulin surges acting up on the brain. And so the brain, this is going to act on the hypothalamus as well as hippocampus. This is going to act on the brain, causing decreased production of TSH. Now, if we're shutting down the whole system because of decreased production of TSH, now the thyroid gland's not being stimulated as well as it should. Now we don't have as much thyroid hormone coming out of the thyroid gland to the liver. This process, again, is being shut down and causing increased reverse T3. I know we're getting pretty in-depth with physiology here, but again, I wanted to recap. We take it from brain, go to thyroid gland. Thyroid hormone is produced by the thyroid gland, specifically thyroid peroxidase enzyme. The total T3 and total T4 and total T3 travel out of the thyroid gland by way of thyroid binding globulin. Now you remember that, and we're going to talk about that a little bit on our next video. So thyroid binding globulin, that carries it to the liver, where the thyroid hormone is cleaved away from thyroid binding globulin and then converted to T3. We need to have all of our factors there with 5' iodinase working correctly to make T3. So selenium is a big one, but cortisol and inflammation can shut down the system, which is going to increase this enzyme 5-iodinase, which is going to increase reverse T3 production, which is another stop signal. So there's a few ways here that we can see that the thyroid hormone can be affected with cortisol or increased stress on the body. Again, a stress on the body is any change from normal physiology. Now, to recoup some of this T3 sulfate and T3 acetate, that goes to gut mucosa, which we need to be functioning correctly. Some things that can throw that off could be gut bugs, such as bacteria that shouldn't be there, parasites, yeast, inflammation, leaky gut. So inflammation caused from food sensitivities. Most of our immune system lines the small intestine. Roughly 80% of the immune system lines the small intestine. So this is an area where we can get immune stimulation, and that in turn can create antibodies. Now these antibodies work on the thyroid gland. So you can see how this is a big cyclical process, or it cycles through. So if we have one area of the body that's not functioning correctly, it can have drastic effects on other areas of the body. So in that sense, we need to assess all areas that we can without being too invasive, but looking at food sensitivities, gut bugs, thyroid function, cortisol, hormones, as we'll get into on the next video, and blood sugar regulation, that definitely can impact the thyroid hormone metabolism here. Have a great day, and we'll talk to you soon.